So my name's Dr. Lederman. I'm here with...
Ted Schlossberg.
And Ted, how did we come to know each other?
Through Kerry Stubbs.
Okay,
Kerry's a friend of mine.
Okay, but other than that, why were you here in the past?
Because I had cancer, in my skin cancer, and they kept on cutting, and it kept on coming back deeper. And I heard about you on the radio. I listened to you. I still do listen every day, and I said, no, I'm going to try this. And I spoke to Kerry, and Kerry told me about what his experience here, and you saved his life, basically.
Okay, so for you were treated some time ago for the skin cancer, right?
Yes.
And you had a series of treatments, right?
Here.
Here. And did you have any side effects from the treatment?
Nothing at all.
Did the cancer ever come back of the skin?
Not at all.
Are you satisfied with the treatment?
100%.
Does it look fine with you?
Yes.
Was there anything bad about that experience?
Nothing.
Was there anything we told you that wasn't true?
No.
Okay, so you had a good experience.
Yes.
Right? And then you came back again another time recently, right?
Yes.
And you came back because of?
My fingers froze. I play musical instruments, I teach.
Okay, so you're a musician, actually.
Yes.
And a composer, right?
No, well, I've arranged music.
You've arranged music, and you're a musician, and you need your hands, right?
I perform, and I teach.
So you can't function without your hands.
Cannot function without.
So what's happened to your hands over, how many years have you had trouble with your hands?
I would say about 5-6 years now.
So 5 or 6 years, and you're wearing these gloves now, and what kind of limitations do you have on your hands?
I can't, when I turn my elbow this way, and my fingers freeze, when I try to play on the lower strings of the viola and the violin, they won't go down, they won't work, they won't move.
So you can't do what you want to do in your life?
I can't.
And how long has it been that way?
About 3 years.
Okay, so you came to me recently, a couple weeks ago actually,
yes.
Right? And we talked about the possibility of treatment with low-dose radiation, right?
Yes.
Had you ever heard of that before?
I heard you say about...
No, but other than from me,
no.
You've seen doctors?
No,
and
nobody ever mentioned radiology.
And you're a smart man, right?
I hope so.
So you're a smart man, but you never heard about it, and no doctor ever told you about it, right? Until you heard me on, what, on the radio?
On the radio, and I heard you mention what is the problem, what you're working with this, and I said, well, that's my problem.
Okay, and you came here.
And I said, I came here.
Okay, so for this treatment, we talked about it, we got x-rays of your hands, right?
Yes.
And we documented the arthritis, right?
I knew I had arthritis all over my body for years. I've known this, but it has never affected me where my fingers won't move.
But we documented what you had.
Yes.
So you have proof of that. You have a copy of that report. I gave that to you, right?
Yes.
And I talked about all the options, right?
Yes.
And you decided to go with the radiation, low-dose radiation.
Absolutely.
And today was your 4th treatment, right?
No, today was my 3rd.
So it's only the 3rd. So you've actually had only 2 treatments.
Right.
When you came and you saw me in the hall and you told me what in the hall today?
I couldn't believe it. Last night we were playing concertos, duet concertos with my students, and I was able to move my fingers, playing the violin on the G and D string, and being able to play double stops, which I could never play because of my fingers. And it worked. It was easy. I felt no pain, nothing. It was just back to normal after 2 sessions of radiology.
So you had 2 sessions which lasted a few minutes, a very low dose radiation, and you were able to play again, and you haven't played like this in how long?
I couldn't play for the last 5 years. I couldn't move on those lower strings.
So for 5 years you haven't been able to move your hands like this, and all of a sudden you have 2 treatments of a few minutes each, and you can play again.
Yeah, it was awesome. Now I have to do my other hand because I have no strength, no muscle there. I keep dropping my cello bows and my violin, so I have to use a German grip because these fingers I can hold, but these fingers, they're weak. They're very weak. I can't do it. So I'm anxious to get this hand done.
But didn't we do the left hand first because that was the worst? That was the worst one.
That's the worst one.
So we did the worst one, and now you're playing music again, correct?
Yes, I teach 6 days a week.
And you're happy?
Yes.
And is there anything I told you that wasn't true?
No.
And what would you tell other people who have arthritis?
You must seek out radiation first as a first step.
They don't have to. They can do it if they want. Right.
If you are intelligent, you get the facts, get all the facts, But the last thing I would do would be surgery. The first thing, radiation. It's non-invasive, it works, and it saves your life.
Was there any side effects?
No.
How has it improved your life other than the music?
Well, now these fingers move. They work right.
Can you wash the dishes? Or
I
can
can do everything.
Pants?
Everything. It's back to normal.
You're back to normal.
Back to normal.
So you're very pleased.
100% pleased.
Any trepidations about it?
No, I would just urge everyone who has arthritis, seek out radiation. Don't be stupid. Seek out radiation because that will work. It'll save you time, it'll save you money, and it works. And it's not invasive.
Why do you think other doctors didn't send you for low-dose radiation? You've seen other doctors about this.
Not radiation, no.
No, but you've seen other doctors. Why do you think they didn't tell you about low-dose radiation?
Because it's the money. Because even the doctor, the nurse that found, thought I had cancer of the head again.
Not the head, of the skin.
I know, skin, yeah. She wanted me to go upstairs to the surgeon. And he would have dug it out, sent it out, and come back and say to me, oh, it wasn't cancer. But I came to Dr. Lederman, and right away he said, that's not cancer. So I would have wasted time, and it hurts. It's ridiculous. You don't go to a surgeon if you can feel and get it done with radiation. That has to be the future of medicine today. Because the surgeon is only there, in my opinion, to make money, but it doesn't work.
Well, it depends if you have a bullet hole through your heart. That might be another reason.
I've seen research today, which by other doctors saying that all these surgeons and all these surgical procedures, they don't work. And things are being developed with radiology and other things other than they're not invasive. And this is the key to the future, non-invasive medical care. And if you don't seek it out, you're putting your life in danger.
Any other qualms to warn people about?
Just seek Dr. Lederman.
Has your experience been good here? Has the whole staff treated you well, by the way?
Very professional, very caring, absolutely.
All right, thank you and God bless you. And you should live to be 120.
Thank you.
Thank you. Thank you for speaking to people so they can learn about this.
No, I talked to my friends about this.
Okay.
And my colleagues.
Well, but these people are not your friends. These are people on the internet who will learn about it thanks to you.
Well, no, thanks to you.
Thanks to you.
Okay.
God bless you.
Nice.